Logansport is where two rivers meet. We are a very dynamic and diverse population.
We all know each other, and so when you know each other, you have that special connection that you want to take care of them. We're not strangers to each other. It's just nice to be small town.
So to start, would you mind just introducing yourself?
Okay, you want me to talk about position as of now or position as of 2 weeks from now? I'm Todd Weinstein. I'm a general surgeon here in Logansport, and I'm the chief medical officer. A community hospital is more embedded in the community.
We are currently, as Logansport Memorial Hospital, a county-owned community not-for-profit hospital.
The nurses and the doctors who live in the community are taking care of people who live in the community, and you know the people you're taking care of, and you took care of their mom last week.
We're the second largest employer, and that's important for the economic fabric of our community as well. The 100th anniversary is really exciting.
The ground itself was donated by the Dyckman family. And just to imagine, this was a hillside that was all wooded. It took 2 years to actually get the building started. The building itself has changed. They eventually in the 50s tore the original building down, built a new building. Since then, we have built on each side of it with the medical office buildings and remodeled and renovated.
When you look back at that, the care that we provided, and as we've morphed and changed, healthcare has changed so much in 100 years.
Cass County has the third most cases of COVID-19 in the state.
Well, rapid testing also happening in Logansport tonight.
Just into the newsroom, 31 more COVID-19 cases have been announced in Cass County after the state said
Our challenges began with COVID. And during that time, Cass County ended up being one of the highest in the nation, like the fourth highest of COVID patients. We've had to cut services, we've had to cut benefits, and we've had to make other cuts.
Care is the epitome of what we do. That's the end result of everything that we do. That's why we're all here. We have really strived, and staff has strived to really stay independent as a hospital, as a community, to do what we can for our community.
It becomes fairly apparent that we need more resources, and the way to get that is by affiliating with a system. And furthermore, if we're going to affiliate with a system, we'd rather do it on our timing and be in charge of the process, so that we can pick the system that we think is going to do the best for us and for Cass County, rather than try to hold on to the bitter end and then wind up in a position where all of a sudden we're forced into doing something we don't want to do.
We did have some must-haves.
We wanted to be with a nonprofit system. We very much wanted to have a relationship where the idea was take care of patients, give back to the community, and give back to the coworkers as well.
And as we went through that process, we really aligned the best with Parkview. When you look at the culture within Parkview and within our hospital, very dedicated, resilient employees that just have the goal to provide quality care to people. And how do we do that together? When we rolled this out, it was emotional.
There is a level of grieving that we have, especially with those that are long-term employees, and even couple that with the 100th year celebration. And we've put out old pictures, and we've put out previous doctors that worked here, and they're like, I remember that doctor. We didn't know those were the good old days back then.
I think the emotional element comes from hanging on to what we feel like was ours, and that ownership of it and that dedication to independence. But knowing too, at the end of the day, our goal is to provide quality care. Our goal is to have service lines. Our goal is to ensure we have jobs for people and we keep employment and we grow.
The community, once they found out that we were Parkview, the phone is ringing off the hook now. Well, Parkview help us with this? Will Parkview help us with that? So it's kind of like, hold on, community. They're here, but let's build this correctly.
There's a lot of work going on in the background to say what needs to be done differently with the transition, what needs to be done after the transition.
They're still going to be taking care of patients, just how they do that, how are they going to get paid when they do that, what are they going to be wearing when they do that. It's all changing. Again, minor, but yet major things.
Will it be a little bit unusual, a little bit weird right at first? I'm sure it will be. Will I probably use the phrase Logansport Memorial Hospital at some point a year from now? I am sure I will.
Can we close it by having you introduce yourself as your role 2 weeks from now?
Sure, Dr. Todd Weinstein, Chief Medical Officer, Parkview Logansport.